All right, let's get started. Good morning. I am David Gomez and coming to you live from London. This is the Ramphal Institute in the second in our series of 4 webinars which examine the issue of air pollution in Commonwealth countries and what's being done to combat its harmful health effects. This is part of a program to improve urban air quality. It's funded by the Foreign Commonwealth and Development Office in Delhi. And the objectives of the program are to build consensus among Commonwealth governments to adopt common objectives for improved air quality in Commonwealth countries as part of a drive for a greener, more sustainable world, and to promote stronger networking within and across India and the Commonwealth, particularly among regional and national agencies operating in cities and urban centers badly afflicted by respiratory and other diseases as a result of poor air quality. The webinars are complemented by publication of a series of policy briefs on addressing the impact of air pollution in urban centers, particularly on women, livelihoods, and human health, and looking at the impact it has on children and other vulnerable groups as well. Together, the webinars and policy briefs provide a run-up to a high-level international forum at the end of March 2021 that will consider policies and strategies for improving air quality in Commonwealth cities and urban areas. And following that international forum, the Ramphal Institute will put forward a position paper to Commonwealth heads of governments to consider for CHOGM 2021, and will also be conducting advocacy or supporting advocacy around the matter at COP26. Welcome to all of you in the Commonwealth and around the world, and to our partners and FICCI and the NIUA, the National Institute of Urban Affairs and the Federation of Indian Chambers of Commerce and Industry who are with us today. And of course, a special welcome to our esteemed panelists joining us from Delhi and from Nigeria. First, let me introduce Dr. Purnima Prabhakaran, Deputy Director at the Center for Environmental Health, Public Health Foundation of India, and additional professor. Dr. Prabhakaran has been leading the effort at the center in conducting research and advocacy around the health impact of air pollution, constructing a national model for retrospective exposure to particulate matter that is now in use in Chennai and Delhi. She has also worked in developing communication materials for WHO India, targeted at women, children, and vulnerable groups. Our other panelist with us today is Professor David Umole, who is Professor of Water Resources and Environmental Engineering, and presently Dean of the College of Engineering at Covenant University in Ota, Nigeria. Professor Mole's research interests include air and environmental pollution, water pollution and groundwater quality, sustainable consumption, and environmental laws and regulations. He is a recipient of the prestigious International Foundation for Science Research grant from Sweden, and has also received research grants from the National Research Foundation of South Africa and the German Development Institute. And our third panelist with us today is Mr. Abil Bala, who is a youth environmental activist and sustainability consultant and sophomore at Ashoka University there in Delhi. He has worked in the field of environmental conservation and protection over 8 years and has partnered with UN Environmental Program, the Delhi Metro Railway Corporation, and the World Wildlife Fund, amongst other agencies. Last year, Abir was featured in a news segment of the BBC for his advocacy work on addressing the problem of air pollution in Delhi. And he has also represented India on the BBC in a conversation with United Nations Secretary General. Abir is currently Director of Operations and Community Engagement at Care for Air in Delhi and has a keen interest in environmental issues pertaining to air pollution and waste segregation, and continues to fight to save the planet. So welcome to all of you again for this our second webinar. But first, let me give my brief take. In 2019, the Economist Times reported that staying indoors to avoid toxic air pollution in Delhi wasn't so safe a move as people thought, because air pollutants had now entered the home. This was followed in 2020 by the Business Standard reporting in their special on the coronavirus that while skies were clear in Delhi, indoor air pollution rose in lockdown India. The long and short of this situation we are faced with today is that taking refuge inside the home, even in air-conditioned rooms, is in some cities a fool's errand. As given the levels of indoor air pollution in homes, it is now as unsafe as being outdoors, if not more so. The World Health Organization estimates that as much as 3.8 million air pollution-related deaths worldwide are due to household or indoor air pollution. This is caused largely by particulate matter emitted from the combustion of biomass, coal, and kerosene that some refer to as black carbon. But the high levels of outdoor air pollution also contribute to higher levels of indoor air pollution, amongst other things. Together, these contribute to lung cancer and other types of lung and respiratory diseases, strokes, and heart attacks. As a child, I recall my own grandmother burning mosquito coils in the bedrooms at night to fend off those nasty mosquitoes. I'm from Belize, so you can understand. She suffered from severe asthma. But little did we know that the smoke from the coils probably contributed to her condition. My own son suffered from asthma as a child, and I'm trying to remember whether or not I was complicit in burning mosquito coils and affecting him. I want to say I didn't. But growing up in Belize, where mosquitoes are prevalent, burning mosquito coils is a common thing, as is the burning of bush in some areas to smoke out the flies, as we say. It is also customary for many of us to cook using biomass materials, wood and charcoal, and though most of us no longer use kerosene stoves, and kerosene lanterns are for use during hurricane season and blackouts, and that's very commonplace. Many of us do these things without thinking twice. But any true Belizean, and I think this is true for other cultures around the Commonwealth as well, will tell you that food cooked on a fire hearth or a wood-fired stove tastes way better than anything any modern day chef can toss up in their fancy kitchens. And I was having a discussion with the panelists before we went live today, and they all agree with me. They're like, yeah, David, you're right with that. So when you are from a developing country, I think cooking on these outdoor stoves using dirty fuels is just something that we do. And we do that without thinking, well, does it have a health impact on us? It is our reality, and millions of people across the 6 corners of the Commonwealth continue to follow decades or centuries old cultural practices for cooking and for lighting their homes. The WHO estimates that around 3 billion people globally still utilize these means of cooking and of providing light. What we do know now is, or that we're beginning to accept, is that indoor air pollution from these fuel sources are all harmful to our own health. And women and children and other vulnerable groups, particularly those with underlying cardiovascular and chronic respiratory diseases, are adversely affected by indoor air pollution. Dr. Ajay Nagpur calls it a silent killer. This was also the conclusion of the Ramphal Institute's first international conference on air pollution in 2018 that was held in London. Yet indoor air pollution receives considerably less attention than outdoor air pollution, and many are in the dark about its negative health effects. I was surprised to find out that, and one source estimated that as little as a year ago, nearly 70% of London's teenagers weren't fully aware of how bad the air pollution in the capital was, or that air pollution was an issue, or indoor air pollution was even an issue for them. Cities and civic groups have started to fight back, though. In India and Nigeria, there have been a concerted push towards incentivizing clean cooking, and women's groups in Nigeria, for example, are taking action to protect themselves and their families from the harmful effects of household air pollution by taking controls of clean energy security. In India, women are shifting to clean cooking stoves as new technologies makes this possible and more readily available. In Odisha, for instance, mobile technologies are being used to help women by providing carbon credits, which they get paid, and that allows them to use that payment to purchase new clean cooking stoves. In today's Ramphal virtual roundtable, our panelists will share their views on indoor air pollution. Well, the questions that we want to tackle today is, what is air pollution really, and what are its causes? Is it only from cooking? Is this different for developing and developed countries? Do people suffer differently in those two areas? Or why do Commonwealth countries lack guidance for indoor air quality? And can alternative energy sources and technologies help to address the adverse health effects of indoor air pollution? What are the obstacles that still remain to reducing indoor air pollution? Is it an issue of finance, or is it one of technology or policy? Or is it just a matter of cultural practices that we refuse to let go of? We will address these questions and more hopefully today. Let me turn now to Dr. Prabhakaran. Dr. Prabhakaran, you're doing a lot of work there in Delhi in trying to address the matter, not only of air pollution, but environmental concerns as well. Tell us a little bit more about what you're doing and how you're engaging on this matter.
Yeah, thank you, Mr. Gomez. And at the outset, let me express my gratitude to Ramphal Institute for this opportunity to speak and share my thoughts at this forum. So good afternoon from New Delhi, India, and good morning to participants from other parts of the world. So at the Center for Environmental Health in the Public Health Foundation of India, we have recognized the importance of environmental risk factors and their impacts on health. It is a well-known fact today that the global burden of disease, a big chunk of it, nearly a quarter, is due to environmental factors. And we recognize that environmental factors are really modifiable factors. We know that, for instance, some other disease burdens, for example, the cardiovascular diseases, oftentimes are attributed to genetic makeup. And those are non-modifiable factors. But when we're talking about environmental risks, many of them are modifiable. And there comes an opportunity for us to work in that space and make a change. So at the Center for Environmental Health, which was established 5 years ago, it's the newest infant within the Public Health Foundation of India, which itself is close to 15 years old today. We conduct research that spans several domains, from air pollution, water, sanitation and hygiene, climate change, chemical toxins and heavy metal exposures, children's environmental health. And all of these are conducted not just in Delhi, where we are sitting, but also in very many other regions of the country, based on a needs-based approach, as well as the fact that research feeds into effective policy making. And that's one of the mandates of the Public Health Foundation of India. Our research doesn't stop at publications as most people think it does. We actually engage a lot with national and state governments in translating that knowledge into effective policy making. As an example, the Government of India's Ministry of Health and Family Welfare was the first government probably in the world to commission a steering committee to write about the air pollution impacts on human health and provide recommendations to the Government of India. This was way back in 2015, when the air pollution season was at its peak in Delhi. And this report gave very many recommendations to the government to put into place certain policies that would change the conditions of air quality, not just ambient, but also the household air quality problems that we are hearing about more and more today. Not so long ago, India was known as the diabetes capital of the world. But today, we have the dubious distinction of hosting, as the WHO puts it, 15 of the 20 most polluted cities in the world. And the ambient air pollution problem is one that is talked about a lot, and Delhi is in the limelight in the discourse very, very often. At the center, we are working with the Harvard School of Public Health and a couple of other collaborating institutions to build a national model on exposure to particulate matter PM2.5. We will use different sources of pollutant data, not just the monitoring stations data, but also satellite data, chemical transport models, land use data, recognizing the fact that very many factors are responsible for deteriorating air quality in India. This model, which is built at a very fine spatiotemporal resolution, will help us then associate particulate matter exposure to very many health outcomes in India. And that will fill the gap for the important evidence base that governments often talk about as being absent in developing countries. So we hope to move the needle and the agenda for effective policymaking once we have the evidence base in India. Like Mr. David already alluded to, household air quality does not find too much space in the discourse, and that is really something that has to change, given that household air quality is also important from the perspective of vulnerable populations like the women and children who are the most affected. And the inequities don't just span between countries, but also within countries. And India is a case in point. We are a vast country, countries within a country. And while the SDI, the social demographic index, might be great in some parts of the country, in some states, it is really low in other parts. And those are the states that really require handholding in transitioning to clean fuels in their households. And it's the women and the children who face the brunt, and those are the population groups that require real focus going forwards. I'll stop there for now and maybe take it on from.
Thank you very much, Dr. Purnima. Professor Mole, let me turn to you, because just before we started, went live on the seminar, we were having our own little chit chat, and we kind of realized that indoor air pollution is in a way directly related to outdoor air pollution. And you were talking about not only the fact that vehicles on the roads, but also the use of generators in homes, because of the Nigerian context, produces a lot of indoor air pollution. Tell us a little bit more about what's happening in Nigeria, what you're doing there.
Thank you very much. And also permit me to appreciate Ramphal Institute for this opportunity to share my views. Well, Nigeria, like we all know, is it's also a developing country. It shares a lot of background with many other developing countries. And one of the challenges of developing countries is the poor supply of electricity. In my country, we have about 200 million people right now, with more than half living below poverty lines. And unfortunately, at national level, we don't yet have the capacity to produce enough electricity for all the inhabitants. As a matter of fact, about 60 million citizens own generators. That is individual electricity generating sets. And when I say 60 million individuals, it doesn't mean, some families, that's like the household head. And you have like 5 people in that household. So you find more than, it's not just 60 million people depending on those 60 million generators. You have far more, at least by some factors, maybe by a factor of 3, multiply that by 3. So you have a high level of noise also associated, because in a very small enclosure, in a small household, maybe in a block of flats, you can have like 4 generators in just a small space, and everyone is generating the fumes, the generator fumes that come from biofuels, of course, petrol, diesel, depending on the type of generator set that you are using. The nation as a whole has just about 5.2 gigawatts generating capacity at peak. However, studies show that this individual generating sets combined have about 42 gigawatts. That's like 5-6 times more than the nation can generate. This tells you how much capital flight we have, because we have to import all these generators from countries that don't even need them, like China, like Japan. They don't use these things, but they produce them, strictly for developing countries like Nigeria. So you see, another study shows that $14 billion goes into purchase of generating sets and fueling this generating sets per annum.
Wow.
Per annum. Now, that tells you, if the nation can come up with $14 billion in 1 year, I believe we'll be able to solve the bulk of the electricity generating problem. But somehow the policy makers are missing this. They are missing this link. that just one-time investment and the proper action is one of the things required to solve this problem. And unfortunately, because of, because people are responsible, some people need these generators, they cannot afford it. Some might decide, okay, somebody's generator is out there, can I just steal it and go and use it in my own home? So for security reasons, some people don't keep those generators outside. They decide to keep it within the houses. Unfortunately, carbon monoxide is odorless and it is colorless. So it is a secret killer. We have a case of about 1,500 people dying from generator fumes every year in Nigeria that is documented. We don't have the number that is not documented. Of course, apart from generator problems, we also have other issues. An average Lagosian spends about 4 hours in traffic every day. And we have about 21 million living in Lagos alone. So if you spend 4 hours and you have, diesel trucks passing, I've experienced it personally several years back, and you have some of these trucks just, it just releases toxic fumes into your vehicle. It's an enclosure. We might say this is not the household, but you spend 4 hours in a particular bus, and much of that time is spent ingesting fumes, toxic fumes from other vehicles. This is another thing. So these are transport problems also, which is affecting more than 20 million people on a daily basis. That's just talking about Lagos alone. So we have some of these problems going on. And the amazing thing is that Nigeria has several standards. We have standards, we have regulations. All these things are documented. These problems are well recognized, they are known. But one of the problems that we have identified, especially in some of my publications on regulation, is the willpower to enforce these things. It's morally wrong when the government itself knows that it is not able to supply the needs of the masses, such as providing electricity, such as providing mass transportation that is clean, such as providing, network of roads that are motorable. They know these things are wrong, but then the willpower to enforce these rules are not there, because even the moral right to enforce it, when you know that you have not made alternative provisions, I think it's also a moral issue on the part of the policymakers. So allow me to also pause here for now.
Thank you very much for that, Professor Mole. I'll come back to you because I still want to talk about at one point the need for generating the link between air pollution and water pollution is a very fascinating one. Let me go to Abir now, Abir Bala, who has had an opportunity to discuss and air this issue on the BBC. I found it, Abir, striking that the youth feel that they are not a part of the governance structures or policy-making processes. And they also seem to be not as aware of air pollution issues. Is that something that you're finding in Delhi? And how do we get around that obstacle?
Sure, certainly. So I think, I'll start with the point that you mentioned, because every year I set a goal for myself, and my goal for this year was to attend COP26, and as a youth delegate. And I reached out, I've been writing to the UN, I've written to the government. And what I was surprised to learn in the process of doing all this is that India has never sent a youth delegation to the climate change conference ever. And the question that naturally comes to my mind is that if we can have activists like Greta Thunberg, why should there be only one? Why can't there be more people like her and doing the work that she's doing? So that's one comment that I wanted to make. I'll just take 5 minutes to I'm going to talk for 2 minutes on my motivation and what drives me, and also about the work that I'm doing. So for me, I think when we talk about climate change, I feel like the word global warming is problematic in the sense that it's the way we discuss global warming is a challenge in itself. in my experience coming out of school, interacting with students through my activism at the ground level, I've noticed that, global warming and climate change are terms that have been reduced to textbook definitions. And, so when I've interacted with students from NGO schools and from government schools, my experience is that, it's just something they study and they aren't aware of what they should do. At most, their belief is that, the response and the responsibility is lies with the government, and at the international level as well as at the national and state level. They believe that individually they cannot do much. So one of the areas that I've been working in is to change that mindset. So I'm working with an NGO called Care for Air, and we're actively reaching out to schools, colleges, RWAs, and we're making presentations. We're trying to catch them young, so to say, and tell them what they can do about air pollution. Whether it's, I was again in the offline conversation that we were having, I mentioned to you that in India, in Delhi, all around me, wherever I stay, people have this culture of taking their car, even if it's just to the neighborhood market, if it's to the park, if it's just in a 1, 2, 3 kilometer radius, they want to use their cars for the smallest of things. Whereas one thing that I do admire about Europe is that, for a small distance in the neighborhood or something, they'll walk or they'll bike. So that's one thing that, we're trying to encourage these students to do. Other than that, we're making them aware of what they can do in terms of smaller things. In Delhi, we have our landfills are overfilled, and a lot of the garbage that's there is burnt, leading to air pollution. So we've been telling them the importance of waste segregation, So my entire motivation and my great idea is to shift focus from global warming being a hot word, these days AI and VR are hot topics. I think we need to shift focus from global warming as such as a term, and we need to look at it in terms of the manifestations. And one of the biggest manifestations is air pollution. And a question that I frequently find myself asking is that, governments take prompt action if there's a terrorist attack or if there's a natural calamity, but they don't take immediate hard action when it comes to climate change. And my understanding is that that's because of the fact that it's not immediate. It's slow, but it's surely happening. And the only way to, make people aware is to give them hard statistics, give them data on how many deaths are happening, what the health effects are. And I think in wake of the pandemic, health is a big agenda on all governments' minds. So I think that's one way to sort of approach the advocacy side of things. At the ground level, I've worked, I've been building awareness by going out. So we have in Delhi, we have the cleanest green metro system, which is the Delhi Metro. And with them, I've been working for 3 years previously. And we reached out, we have thousands and thousands, tens of thousands of commuters going through our metro stations. So we did flash mobs over there. We did, street plays over there. We did plantation drives and cleanliness drives around these metro stations to make people aware of what the problem is and what we can do at the individual level rather than always blaming governments and institutions. So yeah, I think and one sort of thing to answer the questions that you mentioned is that I would also like to focus in today's webinar on when we talk about indoor air pollution, we're always thinking of it in terms of as you mentioned, black carbon. But another big source of indoor air pollution would probably be VOCs, which are volatile organic compounds, which are coming from things like, this whiteboard marker that I'm using right here. Students use these things day in and day out. And right now it smells great, but it's actually very, very harmful for my health. Similarly, we have, upholstery, we have wall paintings. All of these things are not traditionally considered to be sources of pollution. But nonetheless, they do constitute indoor air pollution.
Thank you very much for that, Abir. You're right. I mean, I think what you have been saying is that the narrative has to change. It has to become more appealing to them, and that's something I will come back to you on. But I want to turn back to Dr. Purnima. there is this misconception, Dr. Purnima, that indoor air pollution is a matter for rural areas. But as you were saying in your intro, the urban poor also suffer significantly from this, in particular women and young people. What are some of the challenges that they're faced with in trying to overcome that issue? I mean, we talked about the need for migrating to or shifting to clean cooking technologies, but is that really a possibility? What's being done in India around that?
Thank you. Thanks for the question. So I guess in India, we have recognized that indoor air pollution is an issue. It's a sinister issue in a sense, because it's affecting a big demographic dividend in our country. And rightly so, there was the program that was rolled out a few years ago at the instance of the Prime Minister, called the Pradhan Mantri Ujjwal Yojana, which was to roll out access to clean cooking fuels, especially for the rural population. And recognizing that it is the woman of the household who is the end user and the beneficiary, the woman of the household was made the primary recipient of this program, and they were provided with liquefied petroleum gas, the LPG. But the program, though it has had extensive penetration, it has reached very many households, millions of households. I think the problem was in sustaining the practice. So the problems were manifold. I think one was behavior change at the core of it, because like you rightly said, people really have to understand that the uptake is important from a health point of view. The cultural beliefs about cooking on the chulhas or the traditional cook stoves, the food tastes better, and those mindsets have to change, that it is really the health which is at the core of this problem, and they really need to transition to clean cooking fuels. Sometimes it is also about getting the second cylinder. When you finish one, what are the access issues? So it's at one end, it's a social issue, but it's also a cultural issue, but it's also the implementation problem. So it's the urban poor who are also affected, because it's not just the rural tracts of India. Very many parts of our country are in the rural settings, but also the urban slums. And there is another issue there. They are very closely, densely populated. They are single room tenements often. There are ventilation issues, there's overcrowding. So, and there's also at the core of it, they start in suboptimal environments. So children born into those households are already at a disadvantage. And that just gets perpetuated. It becomes a vicious cycle. Cooking within those households, which already have closed environments, more people, suboptimal health to start with, kind of instigates a vicious cycle of poor health that is just transmitted across the life course. So I think the government has done well in rolling out this program, but there's also there's the recommendation that the Public Health Foundation of India had made in the steering committee report to the Ministry of Health, making the available clean. So if they want to use cook stoves, give them clean cook stoves. Making the clean available, that is, give them the LPGs where it's possible, but also, look at things like smokeless villages, like across the communities, make a change happen. And that only can come from awareness building. I think there's a huge scope for sensitization of the communities about the health impacts of air pollution. And I think it's an intersectoral approach that can make that change happen on the ground.
Yeah, I mean, I think your intervention just now kind of responds to a question that Nicholas Watts raised in the chat just now about the extent to which governments coordinate their health and energy policies. I know it takes place sometimes organically. Are you aware in your case, Dr. Purnima, of any concerted or coordinated effort between the different ministries to address this, between the Ministry of Health, Ministry of Energy, for instance, or Environment, to address the issue?
Well, we do have action already for the ambient air quality management. That is happening already. So the Ministry of Environment has the National Clean Air Program that was rolled out in 2019, January. And that has an agenda to reduce the PM 2.5 concentration in what we call the non-attainment cities, 120 odd cities who are identified to have very poor air quality. But of course, the focus on the indoor air quality, the household air pollution, is still not as much as we would like it to be. And in terms of ministries talking to each other, I guess one example that I could right away give you is the National Program for Climate Change and Human Health. So this was a program that was actually started out in 2015. It's actually interesting. Maybe I should step back in time to 2008 when the Prime Minister's Council for Climate Change was launched. And they had 8 missions, which included missions for solar, missions for habitat, sustainable habitats, missions for biodiversity, but there wasn't a health mission to start with in 2008. It was only in 2015 that a national health mission was launched. And it was at that point that the National Program for Climate Change and Human Health in India was one of the first policy frameworks from any country around the world. That has a big component to address air pollution. So recognizing the fact that there is co-benefits for addressing these two issues together, that oftentimes the causes of climate change, the climate pollutants and the air pollutants are common, the sources are common, and there is immense co-benefit in addressing these two issues together. So I think that's one example where climate change, the Ministry of Health and the Ministry of Environment are kind of not exactly working together, but they recognize that these two issues are important.
Thank you very much. Professor Omole, I don't want to lose this thread because it's a rather interesting one. But you have talked about, or we were talking about the fact that all this electricity generation using diesel generators produces effluents into water. And because of that, you were drawing the linkages between water pollution as an entry into looking at air pollution issue. I found that very fascinating because most of us don't think about that. And I saw Simon Burkett just mentioned that the narrative around air pollution that was raised by Aber is perhaps one of the obstacles that we need to overcome in making air pollution climb the agenda and well, not climb the agenda, but just be given more visibility, better attention. Tell us a little bit more about this water pollution, air pollution link that you have there in Nigeria.
All right, thank you very much. I'll use the example of the city where I live presently. I'll take that example. For example, in Ota, where I live, it's just about 10 kilometers away from Lagos. It's at very close proximity. As a matter of fact, because of the congestion in Lagos, so many industries prefer to locate their factories in Ota, where I live right now. And for the singular fact that many of these activities are not really regulated in reality. They are regulated on paper, the regulations are there, the actions are there, and but everyone just operates, or most people just operate independent of the rules. So a typical factory, of course, uses effluent, generates its own water. The citizens also generate their own water sources. Like I mentioned while we're having that chat, an average household in Nigeria, you can imagine, half the population of 200 million people. By the way, I was having a side chat with Robin and he was asking, is there a way we can control this population before 2050? Because the projection is that Nigeria will hit 400 million people. That is double the problem that we have right now. And as we speak, there is no active program in place to check the population because the cultural, the religious beliefs around here is that the more children you have, the more blessed you are. So you should just keep having those children. And just like Dr. Ponima said, it's the children and the women that suffer when we have all these environmental issues and problems. But somewhere at the background, people still believe just keep having more children within this problem. So back to your question. If an average individual is responsible for his own water production, and like I said, you need your own electricity to pump water from the ground wells up into your reservoir for your family to be able to use. The same thing with the industries that are nearby, where I live. And they generate water also for production. In fact, they use far more water than the households. In the process, they use diesel generators, which is from fossil fuel. And then you find all these things combined from more than, let's say, like 100 industries at the same time, generating for like 15 hours in a day, releasing fumes into the atmosphere. And the houses also, their little generators, releasing fumes into the atmosphere. Much of these fumes contaminate the air, and some of these things get into the households. And because of the congestion in Lagos and environs, where the density, in some parts of the built-up areas in Lagos, you have 20,000 people living in 1 square kilometer of area, 20,000 people. It is not unusual to find a household of 9 persons sleeping in one room of 12 feet by 12 feet. It is not unusual. It's not uncommon in Lagos because of the poverty rate, the expensive cost of buildings, of accommodations, of rent, because you have too many people competing for little space within the Lagos and its environs. So you find that, with that kind of, congestion and the release of fumes from the industries combined with the households, there is just so much pollution going on, both outside, outdoor, and indoor. And just like you mentioned, Mr. Gomez, about your background in Belize, where you have to use coil to control mosquitoes. Of course, this is also the tropics in Nigeria. We also need to control mosquitoes, and people use coils around here too. And not many people will even be able to link these asthmatic attacks, upper airway, obstructions, and diabetes and all these things to air pollution. So we have a high rate. I remember Robin also asked me, do we have Department of Health in Nigeria? Of course we do. We do have, we call it the Ministry of Health. And, but unfortunately, much of what is reported are just curative. People just come, now I have this problem. So just talk to me, just what do I need to do? And you find a lot of people, the money that should be spent on feeding their children, on getting them out of poverty, again, being wasted, in taking care of their health and so on.
Before I go to Abir, let me ask you, would it help any if you had in place indoor air quality guidelines, or if you had better regulatory frameworks or regulations for indoor air quality? I mean, people often say, well, go down the route of regulation, but I'm not sure that it's always the most effective way. What's your take on that? Would that be something that would be helpful in Nigeria and that perhaps could also be applied across India and other Commonwealth countries?
Yes, like I also said earlier, Nigeria has all these regulations about air quality index. We have so many studies. The problem is not the regulation. The problem is not the knowledge of what to do. The problem actually is the enforcement and the enablement, because the enabling environment needs to be in place before you can make enforcement of regulations and policies. For example, I need to have, made sure that poverty is at a low ebb before I can begin to force people and say, okay, don't steal, don't do this, don't do that. The job must be available. Then when you don't do it, maybe when you're doing something else, then as government, I have the moral rights to punish you when you don't do the right thing. But for example, I take away water supply from you. I take it away from you. I don't give you water. I don't give you electricity. And then I come and I accuse you of using your generator to pollute the atmosphere. I mean, it means, I don't know how that sounds like. So it's the enforcement that is the issue. But if it is the paper, I can actually produce for you today the standards that we have about air quality, indoor air quality, and so much, that we have so much of these things. But the enforcement is just near zero.
Enablement, I really like that that term. I want to go to Abir because I think your first intervention, Abir, triggered certainly some responses, and Simon Burkett from Clean Air here in London mentioned that in his chat that analysis of 15 million tweets globally about COP26 over the last 12 months found that less than 1% mentioned air pollution. I was taken aback when in this process when we were having consultations with Commonwealth stakeholders, that one very high-ranking policymaker said to me, "But we don't have time to worry about air pollution. We're focused on climate change." And I thought, well, and then in many of the youth that we've been talking to, and Aber is a part of a stakeholder consultation, youth stakeholder consultation we're having on the 22nd with youth from India, Ghana, Kenya, Nigeria, Belize, Jamaica, and London and England. Many of them did not mention that this is something they talked about regularly. Aber, you might be the outlier here. Why is that? I mean, maybe you're not on Twitter, but you're on other social media platforms. What's happening there? Is this not part of the dialogue amongst young people?
So it's very interesting. And I think so. I am on Twitter, and what I've noticed is, I mean, Mr. Burkitt's data checks out absolutely, because and it's very, very interesting because people look at climate change, and that's exactly what I was highlighting at the start about needing to change the narrative. Because over here we have people looking at climate change as melting glaciers, rising sea levels. Some people will talk about droughts. Some people will talk about, erratic rainfall. All of that's true. But at the end of the day, we've been saying this, for 20 years, 25 years, more than that, ever since climate change has become relevant in social circles. And what comes up is the fact is that nothing concrete has still happened, right? At the end of the day, we're all still suffering. So my idea is that we need to link it to something people can relate to. And air pollution is, that link, according to me. Because what's causing global warming? Emissions. What's causing air pollution? Emissions. It's the same thing. It's about how you characterize the problem, how you market it, and how you tie it directly to the people. That's the first thing. The other thing is, I think, relates entirely to what Professor Mould said, because even here in India, we have a lot of regulations. Earlier in 2020, just what 3-4 months ago, we have a festival of Diwali, and the Supreme Court over here banned firecrackers, as it's been doing for the past 2-3 years at least. And in spite of that, and we had a new clean air commission that was elected, and we believed that it would be much more powerful, a lot more action would be taken. And but Diwali night came and firecrackers were still being burst. And this is the Supreme Court. This is the Supreme Court legislation, order, which is being publicly flouted. And how will you enforce it? I mean, you have so many houses bursting firecrackers. Who all can the cops catch, right? So at the end of the day, it has to come not just from the government, it has to come from the people themselves. And the only way that's going to happen is when people wake up and they realize that, to put it very bluntly, that they're dying because of this problem. And I think that's what is the great part about youth activists, because typically and in my experience, I've interacted with a fair share of governmental organizations, and even with a few ministers, and they typically, by virtue of the position that they hold, they're obligated to take a very diplomatic and a measured response. The situation with youth environmentalists and youth activists is that we have no issues calling out the problem as it is, and because criticism is the only way we're going to get reform.
But is there enough of a voice coming from the youth and from and that's a question I'll pose to Dr. Purnima, from women's affected women's group and vulnerable. Is there enough of a voice, and what are you doing from the youth level in becoming a part of the networks, or helping to forge networks that are trying to address this issue? Because like I said, I mean, I think sometimes what you find are that you have these groups of very passionate youth activists that everybody else looks at and is like, yeah, they're bored, they have nothing else to do. And that becomes a part of the challenge for some people, that it's not seen as something that is yet sexy for youth to be involved in. In London, they were like, yeah, well, we're going to be a part of Extinction Revolution, and they got kind of a lot of attention there. But what are you doing to become a part of the networks that are working to address this?
Sure. So to answer your first question first about whether the voice is being heard enough, I would say there's two ways to look at this, right? One is there is a certain element where the youth themselves are to blame, which is that, and I discussed this with you in our first interaction, which is that a lot of people are taking up not just environmental, but also social causes just for 1 year or 2 years to do it as extracurricular for their college resumes, for their just to have something to show for. So that's one problem that the youth are making for themselves, which is to say that reducing our own legitimacy by starting initiatives and projects which we do for 1 or 2 years and then don't go through with it. And by virtue of that, we may not be taken seriously often enough. And so that's why it's important for people to be committed throughout. And I would like to say, as I have been for the past 8 years over here. But that being said, the second aspect to think about is the fact that youth voices aren't being amplified enough. And that needs to be reflected on both from the international perspective as well as the state perspective. Earlier on, I mentioned that, India has not sent a delegation to a climate change conference. Other countries have. So there needs to be international pressure from the UN and from other countries to say that, why aren't you allowing the youth to voice their concerns at an international level? At the same time, we need to have, a sort of, and this is what I also discussed in my interaction with the UN Secretary General, that we need to have institutional mechanisms to allow the youth to come forward. Right now, I know that the UN Envoy for Youth is one sort of organization which is doing that. But outside of that, there are a few organizations, again, some of them might be doing it just superficially, giving limited opportunities. But considering the huge youth population that India has and other countries in the Commonwealth have, I think we need to, the youth need to stand up and grab opportunities for themselves, and the government needs to assist them in doing that. What was the second part of your question again?
Just about becoming a part of the networks.
Yeah.
So how do you become
so for the networks, I think it goes back to the work that I'm doing around advocacy and awareness, because until people know about the problem itself, how will they work around it? So it's really about telling people about how they're being affected and getting them involved to say, hey, 40 years from now, the politicians who are sitting in parliament right now aren't going to be around, but hopefully we are. And then we have to fight that battle on our own. So, it's just motivating them to sort of step up and take responsibility and hope that people can do it with a true commitment and passion rather than just for their resumes.
Yeah, I mean, well, it's fascinating actually, and I think there's just so much work still to be done. At the Ramphal Institute, we've actually prioritized now a program for youth, but with the focus being on improving access to governance structures and improving access to policymaking processes. Because I think I have no problem with mock parliaments, but I liken that process or that exercise to my giving a 5-year-old daughter, if I had one, a doll house to play with and tell her, you play house. Well, I'm actually, we need young people to be a part of the decision making for issues that are going to impact them later on in their lives. And Dr. Purnima, this was something you were raising in your discussion in the chat there. And I think that you're finding some challenges in bringing together those networks there in Delhi and in India. Talk to us about that. What do you think is required to overcome that, and how can you include representatives from our youth leaders as a part of that, and representatives from vulnerable segments of your society?
Sorry. So, well, I was talking about the challenges about integrating ministries. It's a given. I think it's not just India. I think it's around the world that is an issue where the ministries of health do not talk to the ministries of environment. Abir, for example, in the COP, mostly you see the Ministry of Environment, not just India, a lot of countries. So we really need to take the health people to the COP as well. So, we were talking of having a health COP in Glasgow, but, it hasn't happened yet. But, within Indian settings, I think the challenge is that the ministries work within their line, in lines of interest. So the health ministry will focus on health. The Ministry of Environment has its own for addressing the exposure side of things, the sources of air pollution, the emissions and standards. And then there's the Ministry of Housing and Urban Affairs, which works at city level, which talks to the urban planners. They're also talking about air quality management. But I think the trick is, or the narrative should be that health has to be the center of all these discourses. Health sells. And I think probably the other thing that would sell with politicians are the economics of it, the cost effectiveness of addressing air pollution or climate change or waste management. I think there is a good scope there for changing that narrative and making that happen. We, for our part, do our bit. Like, we talk to the different ministries, we try to bring them together in conversations and dialogues around the table, because there is a clear need for integration of the different programs that they have. The National Clean Air Program, for instance, did not have health in it in the beginning to start with. The Ministry of Housing and Urban Affairs has the Climate Smart Cities program. They talk about making cities climate smart, but there needs to be a health focus there as well. So I think that there is a challenge, but the governments are receptive. At least I think the strategy is to find one champion. If in each of those ministries, if I can find one champion who listens to me, I have been able to make some change happen on the ground. And I think that's been my mantra. That's what I've tried to do. I have tried to zero in on one person who will listen to me. And that's where the integration starts to happen. And so far as the youth are concerned, Abir, I completely agree with you that I think it's a thing now to have your CVs looking good, which is all good, because I think at the end of the day, you need to get to university and you need to make your CV look good. But I think there's change happening on the ground as well. For instance, I started engaging with the Medical Students Association of India. And the reason why I did that was, I'm a physician to start with as well. Like, I never studied air pollution in my medical curriculum. We studied about tobacco as a cause of lung cancer. Air pollution was not in our curriculum at all. And air pollution is the new tobacco. So we're working hard on the ground to talk with the people, the powers that be, to make that change happen, bring air pollution into the curriculum, bring climate change into the curriculum. But I was really surprised when I started engaging with the MSAI, the Medical Students Association of India. They have a 30,000 plus membership, and they do a lot of work on the ground in the environmental pollution domain. So they know about air pollution, they know about climate change, and that's not coming from their curriculum. It's just the sense of awareness, heightened sense of awareness, I might say. So I'm trying to leverage that as well. And it is said, WHO, I think, has documented that health professionals' voice is really revered. And more than the doctors, it's the nurses' voice. So we have a network of healthcare professionals in India that we work with, and we are trying to make them advocates for environmental health. And I think little steps, but a drop in the ocean, but it's starting to make a change. And I think I feel very gratified when I see that happen.
Yeah, in Belize, we have a saying, one fills the basket. David, that probably came from our old Nigerian roots there. But it's interesting because Simon Burkett just put up there that from Clean Near London's analysis, health only included 1.5% of the 15 million global tweets. So, I mean, the discussion of the issues around air pollution and related health aspects and stuff is not really on the radar on the screen for everybody. David, you were talking just now in your chats with others about some of the, perhaps addressing some of the solutions from an economic perspective, and what are your ideas on that, and how can we put forward considerations to policy makers and thought leaders in the Commonwealth to get this across to them?
All right, thank you very much. Yes, like I mentioned in my chat with Kate Johnson, there are solutions, but it's just like salt. When you don't have enough salt in your cooking, it's like the effect is not felt. However, we have seen some of these solutions which are just spot on. They are just good. For example, in Lagos right now, because of the large population and the wastes, that's another source of indoor air pollution in Nigeria, you find that the wastes being collected, they are not, the infrastructure for collection is not efficient enough. So you find households just pile it up, waste dump right in front of the house, and they set fire to it. And some of that smoke gets indoor and choke and, affect the indoor air quality. And with this kind of problem, one of the solutions that came up was the partnership between private investors and the government. As a matter of fact, the government was just controlling the landfill and the end point. From the point of sorting, from the point of collection, sorting, and administration, private. And for many years, this model worked. And many of the private investors in this endeavor made millions. They made a lot of money. But then when the government changed and another government came in, they saw it as an opportunity, and then they introduced one of the, I think the past governor of Lagos State now decided to take the monopoly, set up his own company, and decided, all the NGOs that came in were sent away. Unfortunately, the problem of waste generation and management in Lagos is too much for one single company to manage. So the government before that actually had the solution in decentralizing it, and the government only managed the end point, which is the landfills, the recycling points, and such scenario. The government was able to just stay at the end point, receive it, and solve the problem. And we had non-governmental investors who also worked in setting up their own waste control and waste management endpoints. So we have those kind of things, and it worked. But political will to continue with something, and when you don't have continuity, investors they're scared, because if I invest and I may not be able to break even in 10 years, and the government is just 4 years, and another government comes in and says, oh, there's money in this and there's business in this, and introduces his own sponsored firm, the others tend to lose money. And so because of that, people who are interested in this solution are scared away because of the fear of losing their investment. That is one. Now, in terms of the transport, like I mentioned, Lagos is very congested, just like Abuja, just like Port Harcourt. Many cities in Nigeria have similar problems. And one of the solutions that was introduced was mass transit, in a situation where even though you have your car, you leave it at home because there is a very efficient mass transit system. The Lagos State government introduced what is known as the, a bus transport system, air conditioned. Some of them have internet connections in them. I've boarded some of these transport systems. And one of the things they did was to create special lanes on the roads just for these buses. So even when you're in your private car, you get late, but when you're in that bus system, you get to walk faster because it has its own dedicated lane. So you find more than 100,000, more than 500,000 persons patronizing this mass transit system. Now this goes to reduce the carbon emissions from the individual vehicles. It goes to reduce the fumes that I mentioned earlier that comes from some of those buses that are diesel vehicles that are also sharing the road, because these government buses are air conditioned and the windows are sealed. So if I'm going to spend 4 hours, that is now reduced to 3 hours or 2 hours in the government transit system, then I'm more healthy, I get there faster, life is better, but definitely we need more of these things. The population is far more than the available buses. And then for the indoor pollutions that we are talking about, we cannot shy away from advocacy. We cannot shy away from that. So we need NGOs, and let me mention this. Nigerians are a very religious, it's a highly religious population. The average Nigerian listens to the priest, whether it's the Christian priest or the Muslim priest. By the way, there's a large population of Christians, a large population of Muslims. And whatever the pastor tells them, or whatever the imam tells them, they tend to receive it far more than what the government tells them. So the best advocacy system for me is from those religious organizations. In my chat with Robin, I was also mentioning to him that, when you talk about population, it is right from these religious organizations. The Bible tells you, be ye fruitful, multiply, occupy the whole earth. And that is the message that goes forth. And people say, yes, I have to give back to my own 4 children, 6 if possible. And it's a status thing. I'm happy that I have so many kids. It is from that same pulpit that you can now also tell them that this is not the generation for having the number of children that you cannot cater for. It only breeds poverty. So when we go through that channel, for me, that is the best advocacy. And these are some of the solutions I can propose. Thank you.
Thank you very much for that, Professor Molle. And I'm glad you raised the point of advocacy, because several people in the chat box are talking about advocacy. And it's something that I think Abir has spent his life doing, just advocating for, like I said, he's an environmental champion and he's fighting to save the earth. But Abir, what they're saying is that we need to find a way to enhance social awareness. And people have been in the chat have also been asking, what can the academic institutions do? And Professor Molle has raised here a possibility perhaps we never thought about, the role of religious leaders in this process. How do you think this all comes together? How can we bring this all together? Because advocacy is obviously not yet effective enough on the matter of air pollution.
So I want to answer this question with an anecdote. In Delhi, in the place that I stay, and as in most metropolitan cities in developing countries, there are urban areas here, and there are also, we have some slums, and I have a slum, I think, just 10-15 minutes away from my house. And I was actually interacting with one of the children over there, and I asked them, do you have a heater in the winter, or do you burn wood, do you burn charcoal to stay warm? And he said, no, we just burn stuff and we stay warm at night. Our houses, as it is so small, that's quite enough. But at the same time, what I noticed was, on top of that same child's house, there was a television dish. There in some of the houses around, there were ACs, the very small ACs, but they will not invest in a heater for the winters. So it's about social, cultural mindset changes, which are also important. If someone is preferring to invest in a TV rather than a heater, and would rather burn, wood or coal to stay warm, then that's a fundamental problem. Because if you can afford a TV, you can afford a heater, that's for sure, right? And why this is important in answering your question is because how that social sort of transformation needs to come in, I feel like academia needs to play a huge role in that. I'm in my second year of university myself, and what I've realized now is that whatever it is that I'm studying is not, unless it's something that you need to be taught. That's the sort of assumption that goes with university level education, naturally, because there are barriers to entry into such things. But it's about making information accessible. If the same people in that slum knew how many people were dying because of air pollution, I'm sure that they would probably be rational and sort of not invest in a TV and rather invest in a heater. But at the end of the day, how do you get semi-educated or uneducated people to understand?
It's going to take me time now. It will take me time.
Michael, can you mute your microphone, please?
Sorry. I think I was saying, yeah, I mean, how do you get semi-educated or uneducated people to understand what the problem is and how it's affecting them? And I think that's the gap that needs to be filled in by academia, and that translation of information needs to go through through civic society. It needs to go through NGOs, through activists, and change makers. They need to sort of bridge the gap between academia and the people who are not aware. You're on mute, I think.
Unfortunately, thank you very much, Abir. Unfortunately, we're running out of time on this. So Abir, let me come back to you and give you a minute or two to give any closing thoughts on what you think we need to take forward to policymakers, or any message that you want to send with regards to dealing with this issue of air pollution.
Sorry, you asked me, my network
Yes,
dropped.
yes. I was asking to you. So what are your
Yeah.
closing thoughts on this?
So I think my closing thoughts are what I've been saying throughout. The first would be enhancing, youth voices naturally. That's the thing that I'm most passionate about. Second would be to increase accountability of the government and of institutions such as the Clean Air Committee that was set up in Delhi recently. And as Professor David mentioned, the gap between regulations and enforcement needs to be bridged. And the only way we can do that is if people themselves start to follow, what needs to be done. Um, that being said, and I think concluding remarks, since we're talking about indoor air pollution, I think we need to become aware of the fact that, outdoor air pollution, as we started off by discussing, is as much a source of indoor air pollution, but we also have the smaller things which do matter. I mean, for me to be talking about VOCs and using a whiteboard marker is extremely hypocritical, but then replacing these sources is the solution that we need to find. Replacing that smell of paint, finding solutions to these VOCs which we just can't avoid within our households, are solutions that we need to invest in terms of R&D. So yeah, I think that sums up my thoughts.
Excellent. Enhancing youth voices and increasing government accountability. But David, in turning to you for your closing thoughts, do you feel that accountability also needs to be increased for other sectors of society and economy?
Yes, thank you very much. Of course, every part of society can never do without the other. I just gave an example of NGOs trying to solve a problem, but the political will is not there and they're frustrated. So yes, I agree that the change many times has to come from the people, from the masses. But then that enablement, that enabling environment, it remains the responsibility of government. However, we need to also identify within society who are the people that hold the influence. The moment you can get within society, these are the group of persons that hold influence, then that is the first place to start the discussion. In my environment, I think the religious leaders, the traditional rulers, they are more influential than the political leaders, and they can actually bring that pressure to bear on the political leaders to ensure that that enabling environment is there. I know the average Nigerian wants change. They want results. They want, they want a better life for themselves, but they need someone to show them the way. And I think that's the way to go. You just need to show them the way.
Wow, thank you. That certainly is an interesting one for us to take up going forward. And I think I would certainly try to wrap my head a bit more around that, David. Thank you so very much. Dr. Purnima, let me talk to you, turn to you for your final thoughts on our topic today.
Thank you, David. And I completely concur with what Abir and Professor David have already mentioned. But as closing thoughts, I think I would like to say that, air quality is such a monumental issue, really. And I think it requires both a top-down as well as bottom-up approach. You really need political will at the highest level to make the most effective policies. And those really have to be contextualized. It's not one size fits all. It really has to be contextualized to the region and the context. But apart from that policy making, there is always a gap between the policies made and the implementation on the ground. And I think that speaks to the enabling environment that Dr. David was just talking about. The enablers, the facilitators, I think those are all important factors as well if we really want to move the needle towards, clean air. And bottom-up approach, I think it starts from home. Charity begins from home, and you really need to start from the individual, but also in the communities, creating that groundswell of awareness. And I think it can happen in very many ways. It could be the religious leaders in Nigeria, but it could be somebody else in another context. We have had good experiences with the health professionals. So we have used the health professional voice to advocate for change, because I think those are some of the revered voices in the communities. And I think mass sensitization, Abir, your anecdote about, what a tenement, an urban slum has in terms of, they would have a TV dish, but they will not, buy a heater, is one example. But, maybe that's what we have to harness. Like everybody has a mobile phone. They may not have 3 meals a day, but they will have a mobile phone. So harness digital health, mobile technology, use those platforms to enhance awareness on air pollution. We, for example, have put up, for example, TV monitors in the waiting rooms of our member hospitals in our network. And so the patients, while they're waiting for their turn to be seen, are actually looking at information on air quality and health. In both English and regional languages, we put their graphics on health effects of air pollution. So they are learning about air quality in their region, but also the impacts that it can have on health. So we can harness different kinds of, we can use radio shows, radio alerts. It will just have mass penetration in rural India. So, we just have to be innovative in what we do. And I think both the combination of a top-down as well as a bottom-up approach and bringing all of these together is what is really important. I think
Thank you very much, Dr. Purnima, Professor Olmole, and Abir. Before I close today, I just want to say that Dr. Purnima and a colleague of hers has produced a policy brief on indoor air pollution that will be published by us tomorrow and released publicly via our social media platforms, our website. And it's also posted to the SSRN from Elsevier Network. So that would be the 4th or 5th in our policy brief series produced so far. I think we have one more coming on the impact on women. And for those of you who are interested in staying tuned with us, we do have our next webinar session on the 25th of this month of February, and that will be on agricultural air pollution. That's another area that people tend not to think is a very sexy area, but it certainly has huge impact on human health and society. So I want to thank everyone who joined us today. And what I tried to do today was to give as many people a chance, attendees a chance as possible that were posting comments in there to get the panelists to respond to those. And I think we did a fairly good job of that. It's something hopefully we can get better at, because the idea behind this is for us not to make presentations, but to engage in a dialogue on how we can effectively make changes within and across the Commonwealth and outside of that as well. So thank you all very much for joining us today. And I'll be in touch with everyone, and Abir will be speaking again about our upcoming youth consultation. Thank you all very much, and have a good day and have a good weekend.
Thank you so much.
Bye-bye.
Thank you. Thank you.